Hello, everyone. I am Dr. Chris, a consultant family physician and a lifestyle medicine expert. Today, I will be discussing how to reverse Polycystic Ovarian Syndrome, PCOS, using a lifestyle medicine approach. Now, what is PCOS? PCOS is a hormonal disorder that is characterized by three parameters. One is menstrual disturbances, which could be infrequent or irregular menses, which suggests a lack of ovulation. Second parameter is hyperandrogenism, meaning that the patient has an excess amount of the male sex hormones in the blood. And the third parameter is polycystic ovaries, which are found on ultrasound scan. This polycystic ovary simply means small, multiple fluid cavities within the ovary. Now, how do we diagnose PCOS? The diagnosis of PCOS is made using the Rotterdam criteria. That means a patient should have at least two of the above three mentioned criteria for a diagnosis of PCOS to be made. This means that a patient does not have to have all the three parameters mentioned above. Once a patient has at least two of the three parameters, a diagnosis of PCOS is made. Epidemiology. PCOS is very common among women of reproductive age. That is, women who are within the ages of 15 to 49 years old. And the worldwide prevalence is estimated to be around 15%. This means that 15 out of every 100 women have PCOS. It is a leading cause of infertility among women of childbearing age. Etiology. What causes PCOS? The underlying pathology in PCOS is insulin resistance in the ovaries. Insulin resistance is what drives all the features we see in PCOS. Insulin resistance in the ovary leads to polycystic ovaries. It leads to the ovaries producing excessive amount of androgens, leading to hyperandrogenism, and also leads to menstrual disturbances, which is infrequent menses or irregular menses, which is indicative of anovulation. So insulin resistance also makes the ovaries not to release egg, which is called anovulation. The next thing in my outline would be the clinical features of PCOS. The clinical feature will depend on which of the above three parameters that patient present with. Patient may present with features suggestive of menstrual disturbance, that is, patient may present with complaints of irregular menses or infrequent menses. Or patient may even present with a complaint of inability to get pregnant due to a lack of ovulation. Patient may also present with symptoms suggestive of hyperandrogenism, such as excessive body hairs, especially facial hairs, hairs growth around the chest and back, and also acne. This suggests hyperandrogenism. And then the last feature is polycystic ovaries, which is usually found on ultrasound examination. When a doctor requests ultrasound, it will reveal, or it may reveal, presence of multiple follicles in the ovary known as cysts. So this suggests polycystic ovaries. Now, how is polycystic ovaries treated? The conventional way of treating polycystic ovarian syndrome is symptomatic. You treat the symptom the patient is presenting with. If a patient is presenting with symptoms of menstrual disturbances, we'll give medications like hormonal contraceptive pills that will correct the infrequent or irregular menses. If a patient presents with features suggestive of hyperandrogenism like excessive body hair, we can give body creams that takes care of the excessive body hair. And then we could also give drugs like metformin, which is an anti-diabetic drug to help with insulin resistance. This drug helps with insulin sensitivity. However, this conventional approach is mainly symptomatic and does not address the root cause of PCOS. Now, the permanent approach that offers cure for PCOS is the use of a lifestyle medicine approach, which involves sustainable lifestyle modification. And this approach offers cure for PCOS. This lifestyle medicine approach involves three steps, which I will highlight and explain below. One, you will need to fix your diet. Because I already mentioned that the underlying pathology is insulin resistance. So you want to make your diet to be insulin friendly. What do I mean by this? You want to eat foods that do not spike up your blood sugar level. Because any food that spikes up your blood sugar level will also lead to a spike in insulin. So you want to eat only foods that are insulin friendly. Hence, you want to eat a well-balanced diet that's comprised of only whole food, free of junk food. Preferably, you go for a low-carb diet. You want to keep your carbohydrate intake at between 50 to 100 grams per day. You increase your protein and healthy fat intake because proteins and healthy fats are quite insulin friendly. They do not lead to insulin spikes. So you want to eat a low carb, high protein, and high healthy fat diet. If you want to incorporate fruits in your diet, you want to ensure that you only eat fruits that have a low glycemic index. That is, these fruits will not spike your blood sugar level. Fruits like cucumber, carrots, tomatoes, and also vegetables, these do not cause blood sugar and insulin spikes. So you want to make sure that your diet is low carb, high protein, high fat, and low glycemic index fruits and vegetables. The second step is to practice intermittent fasting because intermittent fasting is a meal frequency that is insulin friendly. This is because during the time when you're fasting, your insulin level is at its lowest. And the longer the duration of your fast, the longer your blood insulin level stays low. So this helps with PCOS. And also intermittent fasting also helps you to lose excessive body fat. So it's important to incorporate intermittent fasting. And then the last step is exercise. You want to incorporate exercise into your lifestyle. This exercise should include both cardio and resistance exercise. Resistance exercise is very important here because it helps you to build muscle, and muscles helps to improve your insulin sensitivity and also boost your metabolism. While the cardio exercise helps to improve your cardiovascular health. Now, if you practice the above three lifestyle measures correctly, you will be able to reverse polycystic ovarian syndrome PCOS permanently. You also be able to reverse infertility that occurs due to PCOS. Thank you for watching. Do not forget to like, share, and subscribe for more healthy lifestyle tips like this. Thank you.